Hi everyone, my name is Meredith Braza and I am a current third year in the Doctor of Audiology program at the University of North Carolina at Chapel Hill. And joining me today is Dr. Meagan Lewis, who graduated from the UNC AuD program in 2007. And Dr. Lewis is a cochlear implant and lifespan audiologist who now serves as the Director of Audiology at Wake Forest Baptist Health. Dr. Lewis, thanks for joining me today.
Thank you for having me.
So I'm wondering if you can start by describing your career path following graduation from UNC.
I feel like my career path has been pretty direct. So after I graduated from UNC, I think I came to work the next week at Wake Forest Baptist. And at that point, I think there were 9 staff members, and I saw patients across the lifespan and started seeing cochlear implant patients, and from there became manager of audiology several years later, and then director of audiology as we have grown, and we now have 16 audiologists at our quote unquote like main hospital setting, and then we have an additional 9 or 10 audiologists in the Wake Forest system. So there has been a lot of growth for audiology in our program.
That's wonderful to hear, and I know our current students love their placements at Wake Forest Baptist, so thanks for having us there. But I'm just curious what your favorite part of a career in audiology is.
You know, it's a really hard question because audiology there are so many different facets. So for me personally, so at Wake Forest, I'm thankful to have the variety, and we were talking about this a little bit. I'm happy to have the diversity that we have, right? Because we've got cochlear implant patients, and then we have a vestibular clinic, and we see people who are, somewhat disabled by their vertigo sometimes. And then we have pediatric audiology, and it's hard for me to pick, but I do love seeing my cochlear implant patients. So I just got done seeing a patient who I've seen for the last 10 years, and he's 12 now and got his cochlear implants. Actually, it was an interesting story. So he passed his newborn screening, and then came to see us when he was about 2, and it's been such a journey for him and his family, and to see his language now, and to see where he's come is so exciting for me.
It's a great answer.
Yeah.
And you mentioned kind of some of the diversity you've had in your role. So how would you say UNC prepared you for that, or for your career in audiology as a whole?
So UNC does a great job of having diverse clinical sites. When I became an audiologist, I don't think that I realized how many different types of clinics that I was exposed to before I came to Wake Forest Baptist. But even when I started, I felt well prepared in terms of the patients that we were seeing. And at the clinic here, we do see a lot of medically complex children. And at UNC, I had already been exposed to several clinics really that see a lot of medically complicated kiddos. I'd also seen cochlear implant patients, and here we routinely take 4th-year externs, and it's not uncommon that our externs may have not been in a placement where they've had a lot of hands-on experience with cochlear implants. And I was fortunate to have that at UNC, and I also had educational audiology experience. So really, I felt like I had such a good smattering of different sites to draw from. And I remember as a student thinking, every different placement that I went to, I remember thinking, this is what I want to do. And then I would go to a different site and think, this is what I want to do. But I think it gave me enough experience in different sites, but in different types of audiology and different types of testing and in rehabilitation to search for what I really wanted. And for me, that's diversity. But for some of my colleagues, not for myself, that was vestibular. And I think really, if you're looking for a program that's going to give you the best overall experience, that's a UNC program. That's one of the best programs, in my opinion.
Well, that's great to hear. And in closing, I just want to ask if you have any advice for current AUD students at UNC. You could share that.
I would say don't limit your experiences. So I can also remember thinking in my days at UNC, well, this is what I want to do, and I want to focus my track on this. But by doing that, I think you can miss out on other experiences that you may also benefit from. So, for example, if you are thinking that you only want to do cochlear implants and don't get that vestibular experience, you don't know what the future is going to hold in terms of looking for a job or something that might be a good opportunity. So I would say that the years that you spend at UNC are your opportunity to get a great foundation, and then to use that as a springboard to do whatever it is that you want to do in the future. And even though you may feel like you've got it planned out, I think that, and as I'm saying this in the middle of a COVID world, I think that things can change in a way that you may not be expecting. And I do think that UNC has well prepared me for different scenarios.
Well, as a current student, that is great to hear. But thanks again for joining us, Dr. Lewis, and best of luck to you.
Thank you very much, and best of luck to you too.